Today is World Kidney Day. On 9th of March every year, World Kidney Day is celebrated all over the world. The purpose of celebration of the World Kidney Day is to increase the awareness about kidney and kidney disorders about in the public about these things. So every year the Kidney Day has a theme. This year the theme is Kidney Health for All, preparing for the unexpected and supporting the vulnerable. Normally disasters will be occurring on and off in the world. Sometimes they may be local, like an earthquake in Turkey or Syria which we had recently, or devastating floods which occurred in Pakistan a few months back. Whenever these disasters occur, there will be a lot of effect on the public and the living conditions as well as the economic conditions of that area. In such cases, the immediate duty of the government is rescue and resuscitation. That means you rescue the people and then try to resuscitate the people who are injured and all these things. But in such a situation, there are 850 million people who are suffering from chronic kidney disease. Such people in those areas of disaster, they are having a double whammy. Initially the first one is they have to face the disaster. Second is they have to get their treatment. They have to go to the hospitals to get the diagnostics. They have to go to the hospital to get their dialysis done, which will be very difficult in these situations. A person who is suffering from chronic kidney disease has to go to the hospital to get his dialysis done. In a pandemic like COVID, which we had few years back, when you go to the hospital, the patients are likely to get infected with the COVID. So they are highly susceptible for these things. In addition to that, they have to get the diagnostic tests and all these things also done regularly. So which may be a difficult thing. When the COVID was occurring, there were so many patients of COVID, the hospitals stopped taking non-COVID patients into their treatment protocols. So there was a lot of problem for patients who are having chronic kidney disease, cancer, heart failure and all these things. So an integrated strategy has to be developed for detection, prevention and early treatment of the chronic diseases so that care and treatment can be given to them. When you come to the chronic kidney disease is a very serious problem. As I had told, 850 million people are suffering from chronic kidney disease. If the chronic kidney disease is not treated properly, they go into chronic kidney failure and they may require dialysis and transplantation. What is a chronic kidney disease? Chronic kidney disease by definition is progressive, irreversible loss of kidney function or kidney damage over a period of 3 months. That is what is called the chronic kidney disease. Then the next question is, when a chronic kidney disease is there, it is usually divided into about 5 stages depending upon the severity of the kidney function. Stage 1 is the earliest stage when the patient will be having minimum effect of the chronic kidney disease on him. Stage 5 is otherwise called end stage renal disease, when they may require dialysis and transplantation. So regarding the chronic kidney disease, what are the causes which produces the chronic kidney disease? There are various causes. The most important thing is diabetes mellitus. If a person is suffering from diabetes mellitus and he is not controlling his blood sugars, he is likely to develop chronic kidney disease. The second common cause is high blood pressure or what is called hypertension. So if a patient is having hypertension and he doesn't take the drugs properly, his blood pressure is high, there is every chance that he will develop the chronic kidney disease. The third common cause is what is called chronic glomerulonephritis. Chronic glomerulonephritis, there is damage to the kidney because of some antibodies which are produced in the body. So this is what is called chronic glomerulonephritis. The fourth common cause is stones. Most of us must have heard about the stones. If the stone is there and it is obstructing the passage of urine, it can damage the kidney and patients can develop chronic kidney disease. Lastly, some of the hereditary conditions like cystic disease of the kidney can affect the kidneys in children as well as in the adults, and that can cause chronic kidney disease. So these are all the causes of chronic kidney disease. So what is the function of the kidney? If you know, then we will know what will happen in a patient with chronic kidney disease. Normally kidney has many functions. The most important thing is excretion of extra water from the body is the most important function of the kidney. Second important function is excretion of waste products from the body like urea and creatinine. The third function of the kidney is called hormonal function. Kidney produces hormones like erythropoietin. This erythropoietin is very useful for the production of blood from the bone marrow. It also regulates the calcium and vitamin D metabolism in the body. So such an important organ, if it is damaged or if it is not functioning well, the patient is likely to develop some signs and symptoms. So, but unfortunately, most of the patients with chronic kidney disease in the early stages, they may not have any symptoms. Unless the kidney is damaged more than 50%, the creatinine level or the blood test may not be positive. In the very early stages, the symptoms may be very vague, like for example, fatigue, weakness, inability to remember things, judgment impairment. Such vague symptoms are the earliest manifestations of chronic kidney disease. So if a patient is having chronic kidney disease and is not able to excrete the water through the kidneys, water accumulates in the body and they can develop swelling of the body. They may develop swelling in the legs, they may develop swelling of the face, and if the water accumulates in the lungs, they may have breathing problem, and that is called the pulmonary edema. If the patient is not able to excrete the waste products from the body, then it is called uremia. So this causes anorexia. That means patients will not be able to eat food properly. They may have nausea, they may have vomitings, and if the levels of the waste products are more, they may act on the brain, causing coma and sometimes convulsions and death. Likewise, if the hormonal functions are damaged, if the erythropoietin is not produced properly, it leads to production of less blood in the body. That is what is called anemia. If there is anemia, the oxygenation of the tissues in the body comes down and he will have fatigue and weakness. And if the mineral and metabolism is damaged, they may have an effect on the bone. So the patients may have fractures and they may have bony pains and weakness. So likewise, depending upon the function, there may be many signs and symptoms of chronic kidney disease. Sometimes there may be changes in the urine. They may have less urine and there may be blood in the urine. So if the patient is known to have chronic kidney disease, then some of the tests have to be done to confirm the diagnosis. The earliest test that can be done is what is called serum creatinine. Serum creatinine is a waste product which is produced in the body, and if the kidneys are working well, the levels will be usually approximately 1 milligram. But if the kidney is not working, the creatinine level starts rising. That indicates the person is having a chronic kidney disease. Second simple test is examination of urine for presence of albumin or protein. If a person is known to have some protein or albumin in the urine, that indicates he may be having a chronic kidney disease. So these are the simple tests by which one can make out if a patient is having chronic kidney disease or not. If they have any of these things, then he may be referred to the hospital for further evaluation like ultrasound, CT scan and other sophisticated tests in the body. So once a patient is diagnosed as chronic kidney disease, what are the options or treatment for these patients? Usually when the patient is in stage 1 to 4, the treatment is mostly medical. Medical treatment consists of dietary advice and medicines. The dietary advice, most important thing is restriction of salt. Most of these patients with chronic kidney disease, they have waterlogging in the body. So if you add more salt, the waterlogging will increase, the blood pressure will increase. So the salt has to be restricted. Second is the patients of kidney disease will have accumulation of potassium in the body. That is what is called hyperkalemia. If the hyperkalemia is more, it can act on the heart, it can cause rhythm disturbances and sometimes cardiac arrest also. So potassium containing foods should be restricted in these patients. What are the potassium containing foods? Normally juices like citrus juices like lemon juice, orange juice or watermelon or sometimes coconut water, they contain lots of potassium. So these things are to be avoided. Other potassium containing foods are like nuts and chocolates also contain potassium. So one should avoid those things. Once the diet is controlled well, then important thing is control of blood pressure. Nowadays we have very good medicines which not only control the blood pressure but they also help in the retardation of progression of the kidney failure. They are called AC inhibitors and ARBs. So blood pressure should be under control for all patients with kidney disease. The third important is giving some diuretics to reduce the water load in the body. Fourth is if patient is having diabetes and then he develops chronic kidney disease, sugar should be controlled. So some of the drugs are there to control the sugar. If a patient is having anemia and there is less of blood in the body, hemoglobin is less, now there are injections available to improve the hemoglobin in the person. So these are the medicines or medical management in a patient who is having a chronic kidney disease. But if the patient has reached a stage 5, the end stage kidney disease that is called, then he has two options. One is called dialysis. The second is called transplantation. Dialysis, there are two types of dialysis. One is called the hemodialysis. That means what happens is the blood, impure blood from the body is taken into a hemodialysis machine and then there will be an artificial kidney called hemodialyzer. So the blood will pass through that, it gets purified and the purified blood goes back into the patient. So this is what is called the hemodialysis. The other one is called peritoneal dialysis or CAPD, or it's also called home dialysis. In this second option, a polysilicon tube is put into the abdomen. A medicine will be there. It has to be introduced into the body through the tube. So this medicine will absorb all the waste products from the body and after 4 hours that has to be drained. So the waste products are removed from the body. This is what is called the home dialysis. The advantage is that the dialysis can be done in the house. So it has to be done 3 times a day, half an hour for each session. So 3 sessions a day are necessary for this. Otherwise, the patient can go for a kidney transplantation. Kidney transplantation means if the kidneys are not working, then if somebody donates a kidney, that can be put into the patient's body by an operation. So the kidney transplantation can be from a live, related or unrelated donor when they are ready to give the kidney, or there can be what is called the cadaveric transplantation. Cadaveric transplantation means when some person dies because of accidents or severe damage to the brain, they develop a state called brain stem death or brain death. So in a brain death, the heart will be beating but person will be dead. So such organs can be taken from the donor and they can be transplanted into the patient so that their life becomes normal. So that's about the transplantation. But all these things are very expensive. In a country like United States, they spend about 48 billions of dollars every year to manage the patients of chronic kidney disease. In a country like Australia, they spend about 12 billions of dollars every year to manage these patients of chronic kidney disease. So countries like India and other less developed countries cannot afford to do all these things. So the best thing is prevention. So prevention of the chronic kidney disease should be the utmost important thing in the country like India. So how can we prevent? The most important thing is if a patient is having high blood pressure should be controlled, BP tablets should be taken. So if the BP tablets are taken and blood pressure is under control, they don't develop the chronic kidney disease. Likewise, in a patient who is having diabetes, the blood sugars are controlled, then they don't develop the chronic kidney disease. Third important thing is if a patient is having stones, then stones should be operated, and if they are removed, the chronic kidney disease will not occur in these patients. Fourth one is called smoking. If a patient is having a chronic kidney disease and they start smoking, then the disease progresses very fast. So chronic kidney disease patient should stop the smoking. They should not smoke. Smoking is a no-go zone for them. Over-the-counter medications. Some of the old people may be having some pain in the knees or joints, so they may be purchasing painkillers from the shop and taking regularly. So such medications also can cause damage to the kidney, so they should be not purchasing those medicines unless prescribed by the doctor. So these are some of the things which are helpful in stopping the development of chronic kidney disease or stopping the progression of chronic kidney disease. So thank you very much. So if any questions are there. Any questions? There are no questions also.